My name is Jeff. I am 37 years old, and for the past 13 years, I've been taking some sort of pain medication, opioids, whatever you want to call it. So this is my testimony as far as my journey went, and I'm going to try to keep it short as possible. So we have cue cards as to why I started taking pain medicine, why I continued, when I stopped, what I learned, what taking pain medication has done to me, and interactions with doctors and just others in the world, what it's taken from me as a person, and what I have taken from it. So we'll start from the beginning, why I started taking pain medication. Early 2005, maybe mid-2005, going into maybe the beginning of 2006, I started to notice that both of my legs were starting to tremor before I would sleep at night, or my lower back. So what this was doing was keeping me from sleeping, and at the same time, my girlfriend, when she was trying to sleep or sleeping, it would wake her up as well. So I went to the doctor and told him a little bit about my medical history and what was going on. So he prescribed me hydrocodone. I didn't really honestly do too much research into this medicine. Yes, I was young, and yes, that's just an excuse. But he gave me the medication or the prescription. I filled it. And that night I took an opiate for the first time. Not first time, when I was younger, going through some, surgeries, getting my leg amputated and my spine worked on. I'd previously taken them, but my parents, weren't in control of the medicine. But this was the first time as an adult, just by myself, that I was prescribed the medication. So that's why I started taking pain medicine, just some general symptoms. And going to the doctor is very easy to access the medication. For the first 2 months, I went to go and see my primary care physician and just told him about my symptoms, and that taking the medicine made them go away at night. My profession at the time, I was a professional, I was a server at a high-end restaurant. So on the days that I was working at night, when I got home, I would just take the medicine and go to sleep. And the days that I wasn't working, I didn't need to take the medicine. So it got to a point with my general care provider, just the interactions between us, that for the next 2 years, it was just protocol, where he told me I didn't even need to come in anymore, that every month, certain date, there would be a prescription waiting for me at the front desk. And sure enough, there was. So, that was protocol for, some time, as far as working and living and taking care of my son and my family, and taking pain medication just to live. Why I continued to take pain medication. After a couple of years, still had the same symptoms, but actually they were getting worse. And I'd love to dive into a little bit more about why they were getting worse, but just due to litigation and some things in the past, I'm limited to what I can talk about. But my symptoms did start to get a lot worse. We got several MRIs through, my doctor, and noticed that in my L4, L5 area of my spine that there was quite a bit of action going on, and just due to some pre-existing conditions that, we needed to figure out a way how to approach the condition. While, at the same time I was taking, opiates, prescription medication. It was basically just putting a Band-Aid on things. So what we did is I got sent to a pain management clinic where what they did is they said we can approach this from several different ways, and what they advised me of during the time was to get an ESI steroid injection series, which is basically 3 months where they put you under and they give you a really strong dose of, it's like almost an epidural, and they put you under when you do this, and you wake up, and so the pain's gone. I mean, for me, it was almost surreal feeling. I was taking pills, opiates for 2 years, 3 years, and now, this ESI, I didn't have the pain anymore. And so what I started to notice, as I was getting off of the pain medication, is that I started to be able to feel again. And that was a really just surreal feeling for me. I started to be able to just feel the air, the sunlight, just things that you normally just don't think about. And I already had a very charted medical history, but just things that you don't think about, I just started to be able to feel again. So I did it for 3 months, and 3 months is up. I wake up one morning, and it just, boom, felt like a grenade went off in my lower back. It was a shock electricity. And my son at the time, his mother and I, we separated. And we'll talk about that later. But I went to the doctor, my primary care doctor, and just was in tears. So he gave me a shot of anti-inflammatory in the butt cheek, and from there he put a patch on my arm, fentanyl, which, going into taking hydrocodone, I didn't do too much research into the medication, and with fentanyl especially, I didn't do too much research going into taking the medication. But for some time, the fentanyl actually did work. It was a patch I put on my body, and for 3 days it took care of the symptoms that I was having with my back. But it was just a patch. But again, I really didn't do too much research about the medication going into it. When I stopped taking pain medicine, what caused me to stop taking pain medicine was being put on fentanyl. I didn't realize how powerful of a drug that it was until one night I was actually at home and my son was asleep, and I was watching this interventions show, where they talk to young kids about being on, illicit drugs. And there was this one where it was a daughter was being weaned off of taking heroin. So the doctor prescribed the mother fentanyl patches to get off of the heroin. And from there, I read a little bit more, like how powerful it was. I crossed the TV screen, and I, thought to myself, like, what am I taking? So from there, my life started to spiral a little bit. I didn't realize how the medicine had taken just hold of me, and that I just wasn't in control, and that feeling of helplessness. So it got to a point where I was abusing the medication, and this was the first time I was abusing pain medication, actually. So I'm very lucky I had people that loved me and, were looking after me, and they told me that, basically things that I wasn't able to see, but I needed to get off of the medicine. So that's why I stopped. Didn't necessarily want to, but went into a rehab center, and can honestly say for 7 days it was the worst experience of my life. It was hell. And after those 7 days, I told myself that I was never going to go down that road again, that mentally, physically, I felt great. Yes, I did still have, some pain, but was learning how to, I guess, monitor it. And it wasn't but a week later, so I was in the rehab center, that once again doctors were giving me medication that I didn't do too much research on, and they prescribed me something called Seroquel, which I didn't know what Seroquel was. Apparently, it's an antipsychotic. With growing up, I was always a very active kid. I mean, I never really had any issues, honestly, until 2005, 2006, which led me down the road to where I am today. So this medication apparently had an allergic reaction with, was about a week after I got out of the rehab center. I had to have a couple surgeries back to back, and the anesthesiologist asked me if it was okay if she used a different anesthesia to put me down, because that it may have a reaction with some of the medication that I was currently taking. And I told her yes, go ahead, let's do it, let's get the surgery done with. I was ready to be just kind of done with everything, and woke up, everything was okay. My dad gave me a ride back home, but I started to notice I had a really bad headache. So that night I actually checked myself into a hotel, hung out with some friends, and that's the last thing I remember. The next thing I remember, I woke up in ICU, or I didn't know where I woke up. I was just pulling tubes out of my nose, out of my mouth. I didn't know who I was, where I was. I just had nurses, doctors rushing. My bed, he's awake, he's awake, he's awake. So it was, 6-7 days in an induced coma, where, some people ask me to describe like the feeling, the sensation, where it was just the most vivid dream that I've ever had, where when I woke up, my brain was just playing tricks on me. It wasn't even just for a month. It was for a while, where just things just didn't make sense. But at the end of the day, I'm glad that I'm alive. But I had an allergic reaction to a medication that was given to me for getting off of fentanyl. So that's when I stopped taking pain medicine. Wasn't shortly after that I started to have some more issues, or I started to have pain that started to come in my amputated leg, my residual limb, and didn't know why it was coming, but it was making my leg twitch, and the medicine that I was taking just wasn't strong enough. So once again, back on the prescription medication, and going through the process of figuring out why. So what I learned was that during litigation, doctors will review your MRIs a lot differently post-litigation, which on the patient side and for everything that has happened to me in my life really sucks. But I've learned to suck it up, and that I'm still alive, and things happen, and that procedures have actually been changed. I'm dealing with amputees and some certain things because of what happened to me. So the most important thing is, I'm alive, and I'm alive. I have a great, son, and I've just been enjoying time with him. But what I learned being put back on the medication was to use the medication properly and responsibly. That I learned the difference between being in pain and being sore, and that when I was in pain, I would take pain medication, and when I was in sore, would just soak in an Epsom salt bath, or get a massage, stretch. But I learned the difference between being in pain and being sore. So getting put back on the medicine and going through the experience that I had as far as going through rehab and getting off of fentanyl, I learned a lot about responsibility and taking medicine responsibly. Now, what has taking prescription medication, in particular opioids, done to me and my interaction with doctors? It's actually hindered my health care in several occasions where everything is mostly done electronically now, to where when I was going through the issues that I was going through, that everything's charted and we couldn't figure out reasons why, etc. But the course of action that my pediatric neurosurgeon, general care doctor, pain management doctor, everyone told me was, hey, let's avoid surgery at all cost. Let's just stay with taking pain medicine, and if we need to get cut, then we get cut. So eventually in 2013, it was maybe 9 months prior to 2013, I was on the medication, and it was just a normal day, but I was sleeping and I woke up and, felt I was thirsty. So at the time I wasn't using crutches or a walker or anything. Like, I'd always been accustomed, I've been an amputee my entire life. So I hop places. So I was going to the kitchen, I was thirsty, wanted to get some water. So I went to go reach up and open up the cabinet to get a glass. And when I did so, I felt like an electric shock in the back of my leg. And I went down with all the force on my amputated leg, which I'm an above the knee amputee. So basically all I have is my femur. And so we call it residual limb. I don't really like the term stump, but I went down with all the force on that leg, passed out, woke up, and the first call I made was to my father and told him basically what had happened, and told him, hey, I broke my leg. And he was, what? How'd you do that? He thought I broke my real leg, but I said, no, I broke my amputated one, and no, there's no way. So it was a really crazy feeling. Actually, I got on crutches, I got up, and I had to maneuver my residual limb with my hand and lift it up and position it. And when I was crutching out, I could actually feel the bones crunching and moving in place. So I got to the hospital, and they did x-rays, and sure enough, I fractured my femur in 5 different places. Now, since I'm an amputee and my leg sits in, the best way to describe it is like a bucket. Take a fist, and so you just imagine a bucket. So that's how my leg fits in. They couldn't put in any hardware, so for 3.5, 4 months, I am laying in bed, and once again on the pain medication. It really hurt, but yeah. So I had someone come every day and replace the bag of ice that was on my residual limb, and I laid in bed for 3.5, 4 months. So going back to the doctors reviewing my MRIs when I was going through litigation and everything, now there's all these things impending my spinal cord and pushing the scar tissues to the different areas and basically causing me to lose motor function in my lower body. So that's the part where you just learn a lot more out of litigation than when you're in litigation about what's really going on with your body and why. So 2013, I elected to have them cut into my back and to untether my spinal cord. Once again, I had tethered spinal cord syndrome as a child, so apparently it got tethered again, and the issues were keeping me from sitting in one place at a time without going through pain. So pain was a big part of why I had the surgery, to get things cleared up in my back. After the surgery, it was a success. I got some motor function restored in my legs. However, the first surgery I had as a child, it took out, and a lot of spinal cord injuries, you get neurological deficiencies. But so as a kid, I got a neurogenic bladder, which basically meant, like, from the 4th grade growing up to pee, I had to use a catheter, which, I laugh about, but in all honesty, as like a young man growing up, young boy, that's something, it's very sensitive and it's very, difficult to deal with, and I didn't really have anyone to look up to or tell. So I was very ashamed, very embarrassed of it. So what the surgery did in 2013 was it went from I had a neurogenic bladder to an incontinent bladder, which means that I have no control over it anymore. It's hard to swallow, but the silver lining was that I'm still alive. Still alive. The interaction with doctors. Going forward from there, had another surgery in 2015, rehabbed myself, and started playing more tennis. That surgery didn't do much to my neurological system. However, it did take out my right and left abductors to where I really had to rehab them for a while. So I started playing more tennis and just being more active and just working on those areas. But what I found is when I started going into the hospital, I would have, legitimate medical reasons for going. And so the doctor would basically come in and they would pull up my medical chart, and everything's listed electronically. So they would come in and ask me what's going on, and I'd straight up tell them, well, I'm feeling this, and this way. And at the time after, there, were several large, ulcer is the medical term, on my residual limb, and they were oozing pus, and I had a fever and all this, and the doctor didn't want to hear that. They looked at the chart and said, okay, well, we don't treat pain. And, my response to that was, well, that's a symptom of why I'm here, but that's not why I'm here. I'm trying to figure out why I'm feeling pain. But for some time, I wasn't even really technically getting the time of day. And, there was one instance where I go to the hospital and I already have a fever, 102 point something, and my whole body is shaking. I'm in sweats, and my residual limb, the ulcer on it was just oozing pus, and I knew that I had an infection. So I went to the doctor, and my general primary care doctor initially, and he said, hey, you need to go to the hospital. You're too complicated of a case for me. So I go to the hospital, I tell them that, and I tell them everything that's going on, that I was in a lot of pain, etc. Well, there's some young cocky doctor walks in and he says, hey, we don't treat pain here. And that's when I just kind of had enough, because of taking prescription medication and opioids in particular. Now that it was attached to my chart for years, I was just being looked at differently. So it was impeding my health care, and it was impeding my life. So not only wasn't I getting the medical care that I needed, but that translated into my everyday life, where I wasn't able to spend time with my son that I needed. I wasn't able to do life, just so many things, that, get interfered with when you're sick. So young cocky doctor walks in, and I tell him what's going on, and he just tells me, yeah, we don't treat pain here. And I just had enough. And I proceeded to go off and say, hey, man, this is bullshit. I'm here for a legitimate medical reason. And at that point, all of a sudden, 2 cops get called onto my bed this first time. And I'm like, oh, my goodness. And the nurses are all looking at me. And basically all it is public shaming. So this instance only happened once, but the public shaming several times, and it makes you feel this small. So I remember I pulled out my phone, I started recording. I started taking photos of the doctor, because I knew that it was unethical doctoral behavior, what they were doing. So all of a sudden, this big tall nurse, he walks by, he grabs the phone from out of my hand, and he said, okay, well, you're not supposed to record in here, take photos. And that took me by surprise, because prior, when I did have to go to the hospital, I had to have a couple of toes amputated, and I was in the newspaper, so the nurses saw that and they asked to take photos with me, etc. So I knew it was full of shit, and so I just said, give me my phone back, that's my personal property.
And he said, nope, deleting, boop, boop, boop. So he went ahead and deleted the videos and photos that I'd taken, but luckily I had the cloud, so it all uploaded. Um, I keep talking about it, but yeah, I sent it to the insurance and then sent it to the hospital, and then they said, hey, okay, this will never happen to you again, but yeah, at least I had documented what had happened to me in that experience.
So where I say it's hindered my health care and my experiences when I've had medical conditions, especially that one run-in with that one doctor, that I did have something serious going on with me, but they failed to even see me, to do tests, to do blood work, x-rays, MRI, to see why I was feeling the way I was feeling. It was just, we don't treat pain. Dad comes and picks me up. I'm in tears. I mean, completely shamed, belittled, feel this big. And go to another hospital. Sure enough, I have staph infection and am hospitalized for 10 days on some pretty major antibiotics. Got PICC line put in, and then even after I left the hospital, was still on the PICC line taking the antibiotics via home health care for 2 months. So, let's say that I let that doctor shame me to the point where I looked at myself and said, oh, maybe it's the pain medicine, and didn't follow up. I mean, I could have died. So, I don't know. Being stuck in this situation and being charted has really worked against my health care at times, and being able to go in and assess and diagnose a medical problem. So my interaction with doctors going forward, taking pain medicine has hindered actually my experience on several occasions. It's just now I've learned how to approach the situation differently, go in and talk about my symptoms rather than I'm just in pain. Yeah, you're going to be in pain no matter what, but I go and talk about my symptoms, what's going on, and try to communicate a little bit better with the doctor. I found that works out a whole lot easier. So, what has pain medicine taken from me? Growing up, I was and I still am, but I was a really outgoing, energetic kid I like to dream big. I still like to dream big, but my strongest muscle has always been my heart, and I just had so much energy, and I just remember 2005, 2006, as the years progressed, I could feel it happening to me, that this energy, my brain, my body, everything was changing, and I didn't understand why until later when I got off of the medicine, and then I got back on, but then learned to take it responsibly. But by then it's too late because my brain's already being changed, and yes, it's never too late for things, but getting on pain medicine and going through my experience and everything that you see in the news about opioids has taken away at times a relationship with my family, relationships with women, relationship with my son's mother, relationship with my son. Not relationship, but just being able to feel. That's the hardest thing. Being able to feel. And just, work relations, being able to work a regular job without knowing how I'm going to wake up the next day, how I'm going to feel. Just with business, friends, side effects with the medication, anxiety, irrational, just, you name it. Taking opiates has taken a lot from me. And now I know that while I may need to still take them going forward into the future, that
it's more of, as I said in the past, learning the difference between being in pain and being sore, when to take them and when not to take them. So it's taken quite a bit from me, but I've learned a lot from taking opiates. And what I've taken from taking opiates is it's given me a greater appreciation of life. When I hang out with my friends and my friends are going through issues, and I, kind of talk to them, and I've learned more patience. I've learned to do research into the medications that are prescribed to you when you go to the doctor, or you're in the hospital, or you're in a different setting. I've learned a lot from being on pain medication and opiates and everything that's going on now, this big debate, which, I've taken away just as a positive in my life, knowing that I'm not going to let other people, because in the past I was taking the medication because I thought that I was trusting doctors. It was what the doctors were telling me that I needed rather than what I thought that I needed. So now it's to the point where I know that, I'm not looking at. So now it's to where I'm doing what I'm doing to better myself, to better Jeff as a person, as a human, and a responsible human going forward, rather than just taking the advice of others as what they think would be best for me, but looking at, okay, what's best for Jeff, and what do I need to do to better myself to move forward. If that includes having to take pain medication every once in a while, that's okay with me. I don't care, what others now think of me and having to take pain medicine. I mean, for a little while it was, people use it against you. You drop ammunition and people will pick it up and fire it back right, your way. So that's what I've learned, is to do what's best for Jeff, and that will keep me around the longest, for those that love me and that I love them, and just my health in general. So I've learned a lot over these last 13 years, but at the same time, it's been a journey, and I think there's a lot to be learned from both sides right now, both from patients and from the doctor's side, nurses, and I think that there should be a really good dialogue that opens up, instead of, opiate, blah, blah. I mean, it's time to open up a dialogue and talk about things. And so if you're taking medicine just to get high, like I did with fentanyl for just a little while, that's not the right way to go. It ruins it for the rest of us now, where I need to take some pain medication every once in a while to live, to be the best version of myself that I can be. So if you're doing that, maybe seek some help. I see a counselor. I talk to my parents regularly, talk to people regularly that know my situation, and when I need help. So just don't ruin it for the rest of us, and don't feel bad that you're stuck in the situation and you feel helpless. I felt hopeless as well, but if you do need help, go and seek help. But for the last 14 years, this is my testimony, and I've been through quite a bit, but just glad that I'm alive to be able to share my experience, in hopes that it will be able to help someone else. If you have any comments or anything, you can drop them down below. But I plan on doing a couple more of these on some different subjects. So anyways, howdy from Houston.